Now, let's talk about Norgesic Forte, a medication that contains a combination of orphenadrine, aspirin, and caffeine. This medication is used to treat muscle pain and is often used in combination with rest, physical therapy, and other treatments. Orphenadrine works to relieve muscle pain, aspirin helps to reduce pain and swelling, and caffeine can enhance the effects of aspirin on pain relief. It's important to follow the prescribed dosage and take this medication at the optimal timing for the best results. When taking Norgesic Forte 50 mg, 770 mg, 60 mg tablet, it's important to follow your doctor's instructions. Do not take more than prescribed, as it will not speed up your recovery and can increase the risk of side effects. If this medication upsets your stomach, try taking it with food or milk, and always take it with a full glass of water unless your doctor tells you otherwise. After taking the medication, avoid lying down for at least 10 minutes. The dosage will be determined by your medical condition and how you respond to the treatment, so use the smallest effective dose. Since this medication contains caffeine, be mindful of your caffeine intake from other sources such as coffee, tea, colas, and chocolate. If your condition persists or worsens, be sure to inform your doctor. If you experience dry mouth, dizziness, drowsiness, lightheadedness, blurred vision, upset stomach, heartburn, nausea, vomiting, constipation, or trouble sleeping while taking Norgesic Forte, it's important to tell your doctor or pharmacist. To relieve dry mouth, you can try sucking on sugarless hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. Remember that your doctor has prescribed this medication because they have determined that the benefit to you outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. However, it's important to notify your doctor right away if you experience any serious side effects such as mental or mood changes, shaking, fast or irregular heartbeat, hearing changes, difficulty urinating, easy bleeding or bruising, fainting, eye pain, unusual tiredness, signs of kidney problems, yellowing eyes or skin, dark urine, or severe allergic reactions. This drug may rarely cause serious bleeding from the stomach or intestines. If you notice stomach or abdominal pain that doesn't go away, black stools, or vomit that looks like coffee grounds, stop taking this medication and seek medical help immediately. If you experience a serious allergic reaction, including fever, swollen lymph nodes, rash, itching or swelling, severe dizziness, or trouble breathing, seek medical help right away. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects not listed, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Norgesic Forte, make sure to inform your doctor or pharmacist if you are allergic to orphenadrine, aspirin, or caffeine, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems. Tell your doctor about your medical history, especially if you have eye, stomach, intestinal, or esophagus problems, difficulty urinating, certain muscle or nerve diseases, asthma, heart problems, high blood pressure, kidney or liver disease, mental/mood disorders, or certain enzyme deficiencies. Be cautious when taking this medication, as it may make you dizzy or drowsy, or cause blurred vision. Avoid alcohol or marijuana, as they can increase these effects. Do not drive, use machinery, or do anything that requires alertness or clear vision until you can do it safely. If you are scheduled for surgery or certain medical procedures, inform your doctor that you are using this medication and about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. This medication may cause stomach bleeding. Limit alcoholic beverages and stop smoking to reduce the risk of stomach bleeding. Norgesic Forte contains aspirin, and children and teenagers younger than 18 years should not take aspirin if they have chickenpox, flu, or any undiagnosed illness. Older adults may be more sensitive to the side effects of this drug, especially confusion, stomach ulcers, constipation, drowsiness, or trouble urinating. Women of childbearing age should discuss the benefits and risks of this medication with their doctor, and should not use this medication if they are pregnant, plan to become pregnant, or are breastfeeding. Drug interactions can affect how your medications work and increase your risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not change the dosage of any medicines without your doctor's approval. Some products that may interact with Norgesic Forte include dichlorphenamide, methotrexate, mifepristone, and vemurafenib. This medication may increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs like clopidogrel, blood thinners like dabigatran/enoxaparin/warfarin, and others. Be sure to check all prescription and non-prescription medicine labels carefully, as many medications contain aspirin, other NSAIDs, or caffeine. These drugs, if taken together with Norgesic Forte, may increase your risk of side effects. However, if your doctor has directed you to take low-dose aspirin to prevent heart attack or stroke, you should continue taking the aspirin unless your doctor instructs you otherwise. It's also important to tell your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Check the labels on all your medicines, as they may contain ingredients that cause drowsiness. This medication may also interfere with certain medical/lab tests, so make sure lab personnel and all your doctors know you use this drug. If you suspect an overdose and the person has severe symptoms like passing out or difficulty breathing, it's crucial to call 911 or your local poison control center immediately. In the U.S., you can reach the Poison Control Center at 1-800-222-1222, and in Canada, you can contact a provincial poison control center. Symptoms of an overdose may include unusual excitement, fast or irregular heartbeat, seizures, rapid breathing, mental or mood changes such as confusion, and changes in the amount of urine. It's important not to share this medication with others, as it has been prescribed specifically for your current condition. It's also important not to use this medication for any other condition unless your doctor tells you to, as a different medication may be necessary in that case. If you are taking this medication for a long time, your doctor may recommend lab and/or medical tests, such as liver/kidney function and blood count, so it's important to keep all medical and lab appointments and consult your doctor for more details. If you happen to miss a dose of Norgesic Forte, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one and take the next dose at your regular scheduled time. It's important not to take a double dose to make up for the missed one. It's important to store Norgesic Forte 50 mg, 770 mg, 60 mg tablet antiplatelet drugs-excluding ASA 325 and below at room temperature, away from light and moisture. Remember not to store them in the bathroom, and always keep them out of reach of children and pets. When it comes to disposal, never flush these medications down the toilet or pour them into a drain unless specifically instructed to do so. Make sure to properly discard this product and it is expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.